Welcome to STEADI, Getting Started. STEADI, which stands for Stopping Elderly Accidents, Deaths, and Injuries, is an evidence-based older adult fall prevention program designed for clinicians and their staff. Clinicians and staff are encouraged to take the comprehensive STEADI course that includes more complete descriptions of screening options, risk factor assessments like gait and balance testing, and effective fall interventions. The comprehensive course, STEADI, Older Adult Fall Prevention, also explains how to integrate STEADI into your clinical practice. This course, STEADI Getting Started, presents a quick and easy way to get started with the STEADI program. It focuses on 3 key tasks that can be completed during a typical office visit. Following this course, you should be able to describe the burden of falls among older adults, screen for fall risk using 3 key questions, identify types of medications that increase fall risk, explain the 4 critical aspects of a medication review, and describe how vitamin D supplements can reduce fall risk. Learning these things will enable you to implement 3 strategies to prevent falls in older adults. The goal of this course is simple. When you see your older adult patients, decrease their risk of falling by doing 3 things. Ask your older patients about their fall risk using 3 simple questions. Have you fallen in the past year? Do you feel unsteady? Do you worry about falling? Review your older patients' current medications and stop, switch, or reduce the dosage of drugs that increase fall risk. Recommend vitamin D supplements. These 3 actions are your first steps to making fall prevention a regular part of your practice. Why should you care about reducing fall risk? Falls are costly and preventable.
Falls are a huge problem for older adults, people 65 and older, and falls are the leading cause of fatal and non-fatal injuries. The problem of falls is getting worse. The rate of fall injuries is increasing, and the population is aging, so the number of older people at risk of falling is also increasing. So overall, the burden of falls is just getting greater and greater.
Clinicians can really make a big difference in helping to reduce patients' fall risk. There are a number of treatments that can be instituted that can help to improve our patients' balance and reduce their risk of falling if clinicians will do the screening that we have recommended and that we are implementing here locally.
STEADI gives clinicians the tools to directly impact their patients' fall risk in the clinical setting, as well as also giving them information about how they can reduce their risk through behavior change.
STEADI has provided an algorithm for us to use in order to address this epidemic of our patients that fall and sustain these injuries. The STEADI program really gave us the outline and the tools to use to begin to address this very major problem.
Fall screening and assessment are recommended by the American Geriatric Society. In addition, fall prevention is a required element of the Medicare annual wellness visit, which may include screening and assessment. Implementing the STEADI program will improve patient outcomes. STEADI reduces fall risk, and early adopters of STEADI have seen significant improvements for their patients.
STEADI has impacted our practice in a number of ways. I think that it's helped to enhance teamwork in the clinic because staff and providers are really working together to make STEADI a success. And patients love STEADI. They really feel that it means their providers and their team are paying attention to their risk for falls and giving them some tangible things that they can do to reduce their risk of falls. So I think it's made a big difference.
Since implementing STEADI, we have noticed a very significant decline in fall rate in the Broome County area. Prior to going into this, we had approximately 290 hospitalizations for fall-related injuries per 10,000 patients above age 65. Since implementing this, we've dropped down to about 220, 230 falls per 10,000. So we've had a very substantial drop in falls. In addition, at my own clinical site, we went back and looked at the incidence of vertebral, pelvic, and femur fractures prior to implementation and looked at the rate since implementation. And on our initial analysis, we found that the fracture rates that I mentioned have decreased in the range of about 30 to 40%.